Good morning. Another day, another case, 2 consecutive days every morning we're operating, placing the implant. Yesterday I placed a normal implant into the heel wound. Today, a very interesting case, very interesting in the sense of we're doing everything. We extracted the tooth, we have already placed the implant. Normally I start my video before placing the implant. Today I wanted to show a very interesting thing what we're doing. So we have extracted the tooth, we have placed the implant, and now we're going for an immediate temporary tooth placement. So this is a temporary abutment. So this we will fix it as patient is going abroad for some time, and we're coming back and we're going to do a full mouth rehabilitation for him. For the frontal aesthetic reason, he wanted a temporary front tooth, and because we have already planned for a full mouth rehabilitation, we have started placing the implant in a strategic position. This is one of my position where in future, whenever the full mouth rehabilitation or complete set of teeth with the implant we're going to place, this will be one of the implant position. So we started placing that, we do that. This is called strategic implant placement for the future planning. This is a common question again asked to me, that if someone has a root which is remaining inside and going outside, that is he wants a tooth immediately and cannot come back to me in 2-3 months for the permanent, or for the social or aesthetic reason, he wants a tooth immediately after extraction. Is it possible? Not always possible for the molars, because that will be a functional area. It requires the stability of the implant, that is the implant when placed into the bone should be engaged or should be fixed into the bone with particular force. So we do have this gauge, we call it a top range, where we can measure the primary stability of the implant. So after certain stability of the primary stability of the implant, we can place a temporary, we can give a temporary tooth. In this scenario, this is a front tooth. So by the way also, this is not a functional tooth, this will be a more of aesthetic tooth. And I've got amazing primary stability. We have retained all these gums without incision, just extraction, and we have placed the implant, so the gums and everything are intact. We're going to place this temporary abutment and build an immediate temporary tooth for him. So after extraction, placing the implant, we can give a temporary tooth which is aesthetic in a frontal region in an hour. So yes, that is possible. We require certain stability, we do have a primary requisites for that, which was fulfilled by him, and now we are going ahead and placing a temporary tooth for him. I'll share a photograph after this how we have done that. Thank you very much.